Guam has already had numerous confirmed cases reported and 2 confirmed deaths related to the H1N1 virus. And as the pandemic continues to be cause for concern around the globe, there is now a vaccine that will at least put people at ease. But there are some who are skeptical over the possible long-term effects. Dr. Thomas Shea is a delegate to the American Medical Association and the president of the Guam Medical Association.
I think what we're going to be doing, Mana, is go ahead and listening to what the Center of Disease Control recommendations are. And as patients, I think they need to be informed on what the side effects, what the benefits, and the risk. And as physicians, what we need to do, even as nurses, you need to talk to the patient before they get the vaccine on the benefit and the risk.
The vaccine just approved by the Food and Drug Administration, and there have, of course, been studies conducted on that vaccine.
The New England Journal of Medicine just published early last week noticed that the clinical trials was really limited. I mean, they gave the vaccine to about 120 subjects. Total subjects was 240, but when they randomized the clinical trials, it was down to only 120. So basically, you have one study that given the vaccine to only 120 subjects. And based on the 120 subjects, they now want to immunize millions of people, I think, on there. So that's the biggest concern, is what are the side effects and what are the consequential effects of this vaccine.
And even with the studies conducted, Dr. Shea says they can't know for sure what the long-term effects might be, but he says he still believes it would be better to get vaccinated for the H1N1 virus.
With any kind of vaccines, okay, there's always side effects to the vaccines. And with this particular vaccine, the H1N1, because of I shouldn't say the rush into judgment of the vaccine, I think the initial trial that came out of 120 subjects, it only shows very minor adverse effects, local tenderness. There was no major side effects associated with 120 subjects. But then again, you know, the real test is going to come out when millions of people gets it. And they're going to be watching this probably very carefully on what the side effects, what the long-term complications of these vaccines. But if the H1N1 vaccine is similar to the seasonal vaccine, then I think the benefit is going to outweigh the risk of not getting it.
The Centers for Disease Control suggests that everyone get vaccinated, and that includes children and expectant mothers.
Certainly, we know that H1N1 does affect pregnancy because they're a more higher risk population. So I think inoculating them with the vaccine is better. The benefit probably will outweigh the risk of getting the actual flu-borne H1N1 infection.